Good morning, Senior Pride here. This morning I'm discussing a topic that is as much important for our family, friends, caregivers, etc., as it is for us. And it's about supporting older adults to live independently. Now we know the older population is changing. We're expanding, we're getting bigger globally. Um, it's important to support independence. It's not just because it's a financial issue, it's also closely tied to our physical, emotional, and social well-being, and that is in turn tied to our quality of life. So we can look at things like healthcare, housing, social inclusion, technology, finances, and community engagement. All of these things are important to independence. So first of all, we need to understand the challenges that are faced by those of us who are a little older. There are issues of physical and cognitive decline. So certain chronic illnesses like arthritis, diabetes, cardiovascular disability can hinder mobility, they can hinder daily activities. As well, cognitive impairments, diseases like dementia or Alzheimer's, these can create barriers to just basic independent decision-making, self-management, self-care. And of course, seniors are more prone to things like falls and injuries. And that can lead to long-term immobility. It can also lead to feelings of fear about leaving the home environment, which can result in social isolation. We also know that the loss of friends and family, spouses, that leads to isolation. And that in turn can lead to increased feelings of depression, cognitive decline, and all of these things complicate the ability to live independently. There's also the issue of finances. So for those of us who are living on a limited income, whether it be because we didn't put away enough retirement savings or we had other issues to contend with, it affects our ability to afford healthcare, decent housing, essential services. There are also environmental barriers, and simply put, inaccessible homes, lack of accessible public transportation, and for those of us who are living in poverty, unsafe neighborhoods. This can hinder mobility and independence. So we need to address these challenges with comprehensive solutions, and we actually need to support older adults in leading fulfilling, independent lives. First of all, we need to promote physical and mental health. So that includes access to healthcare, and we can do this through telemedicine. We can do this through supporting older adults to meet direct medical needs. We can talk about preventative care, and that means regular screenings, vaccination, wellness programs, things that support prevention. We must encourage physical activity. So exercise programs, and there are, at this point, depending on where you live, there you may have access to like fitness programs for yoga or Tai Chi. There you can swim. You can at home. I mean, I don't have access to these things, but I do all my stuff at home. I slowly amassed a quite nice weight training setup in my own room, and I have a yoga mat, and it's not the greatest yoga mat, but it works for me. And all those things work to increase my independence in physical activity. They allow me to maintain a healthy physicality. There are community classes at community centers, and if you can get to them, if you can support an older person in getting to them, there may be like walking groups, chair yoga, all kinds of things, even for those with limited mobility. That being said, mental health is just as important, if not more. And we need to help older people to access counseling where they can learn to cope with grief, anxiety, depression. We need to provide cognitive stimulation. So that's things like puzzles, reading, social games. All of these things can enhance brain function and maintain it, and they can delay or stop the onset of a cognitive decline. Nutritious diet. We need to offer folks resources for healthy meals. If they're living in a facility like I am, we need to help them learn to choose the healthier options. We also can look at organizations that provide home meals. So they provide meals, they bring them to the senior, like Meals on Wheels. I think most of us have heard of that, at least in North America. And these provide a really great resource for seniors to maintain independence, even if cooking is no longer viable for them. We also need to look at adapting housing and living environments. So we can make home modifications that allow seniors to maintain their own environment to live in their home. And that may be accessibility features like grab bars, ramps, stair lifts, non-slip flooring, smart home technology. So voice activated lights, smart thermostats, and security systems can really make a big difference. We talk about aging in place, and this allows older adults to stay in their home environments for either lifelong or at least a much longer period. And this includes things like programs for home maintenance, like repair or yard work, and um, supporting seniors to like I said, like the cooking program, so Meals on Wheels, allowing them to access nutritious meals without necessarily having to do the cooking if they're no longer able. The other thing is some alternative housing options. So there's co-housing communities, and this means that seniors can live in shared housing arrangements with others, and this may foster shared community. It may foster resource sharing. There's all kinds of positivity. There's also assisted living, and these are facilities that blend independence with access to support services, and they kind of provide a middle ground option for older adults who need some support but are still able to do much independently. It's important to look at technology and how it can support independence. So there are things like health monitoring devices, fitness trackers, medical alert systems, and these provide real-time updates on health, and they can alert both the senior themselves and supporters to caregivers, etc. They can allow them to recognize when an emergency is happening. There's also communication tools, so video calling apps and social media platforms actually can help older adults to stay connected to family and friends, which reduces feelings of isolation, which in turn reduces the risk of depression and anxiety and supports a healthier sense of self. And, there's online forums and virtual communities that offer all kinds of opportunities for social engagement. Of course, there are educational resources. So, technology training programs designed to support seniors in learning to be more effective in using their technology can also, in turn, provide them with access to things like services, education, entertainment, interaction. There are things like assistive devices. Now, I don't know if you can see them, but I'm wearing hearing aids. And there's also mobility scooters, wheelchairs, etc. There's also speech to text software. All of these things help older people in living their daily lives independently. There's also the importance of fostering social inclusion, community engagement, family interaction. And social connections are very important for well-being, for health. So look at local programs. There's senior centers that provide activities like art classes, book clubs, volunteer opportunities. All these offer opportunities for engagement. And there are intergenerational programs in places, and these connect seniors with younger generations, and that can not only help combat loneliness, but it provides opportunities for mutual learning. Of course, we need to look at transportation solutions. So, you know, public transit that is adaptable and meets the needs and accessible and does so for people who are older, provides access to healthcare, grocery stores, social activities. Um, if that's not available, there are volunteer driver programs or ride sharing services that are tailored for older people can be very supportive. Volunteer networks are very important. So, looking at community-based volunteer work networks can offer someone companionship. It can offer them assistance with errands, and it can offer home visits for those who are more isolated. This is important, that advocacy for inclusion. So we need to encourage local governments, seniors, housing uh, governments and organizations, and we need to adopt policies that promote accessibility and inclusion. And that means ensuring public spaces that are senior friendly. That means housing that is supportive and positive. All of these things can be done through advocacy. Of course, there's the issue of financial support. The retirement planning and savings is very important. I mean, we tell young people this and they don't listen, and yeah. But the fact is, education on financial planning early in life can help individuals prepare for the later years. And government programs like subsidies or pensions really need to be optimized to address the financial needs of older populations. We also need more affordable housing and health care. And that means policies that promote affordable, safe, positive senior housing and healthcare coverage that can reduce financial stress and promote independence. Financial literacy programs for seniors are very useful. They provide workshops and resources for older adults on managing their budgets, on avoiding fraud schemes, on accessing financial aid, and all of these can help seniors with their lives, and again, to be more independent. Now, what is the role of caregivers and support networks? Well, first of all, respite care. So for family caregivers, they need a break. It's just that simple. And respite care can help them to continue offering support to their older person without burning out, and at the same time allowing that senior to live independently through this kind of part-time support. We need to offer training for caregivers. So that means that they need to be equipped with the skills to support older adults positively, foster independence, and not harm. We need to encourage peer support. So older adults do benefit from peer mentoring or support where they share experiences and strategies for independence. And of course, this one, and I always touch on this one, and I seem to always bring up the Alberta government policy recommendations for governments and organizations. So, health policy, we need to expand access to universal health care, and not just expand access, but expand the quality of that health care to ensure that no one is ignored, does not receive decent health care because of finances or where they live. We need to look at urban planning. So we should encourage cities to design themselves with age-friendly infrastructure. And that means walkable neighborhoods, accessible public spaces, places that promote mobility and independence. Workforce inclusion is one that doesn't get talked about often, but it is important. So encouraging flexible work opportunities for older adults will allow them to remain active, financially secure, and ultimately independent. And we need to provide advocacy for our caregivers. So offering tax benefits, subsidies, paid leave for caregivers from their jobs acknowledges the vital role they play in caring for older adults, in supporting older adults. And I'm going to give some examples of best practices. So Japan comes up again and again. They have implemented innovative programs like robotic caregivers, senior-friendly urban designs, and they really do set an example for the rest of us. There are aging in place programs in the US, like Village to Village Network, which connects seniors with local resources and it fosters community support. And then there are the Scandinavian models. And countries like Sweden and Denmark prioritize social welfare policies, and they ensure that seniors have access to affordable healthcare, housing, and community services, which helps them to maintain their independence. So, this is a multifaceted issue, and it requires collaboration among individuals, communities, and governments. It's important to address healthcare, housing, technology, social inclusion, financial security, caregiving issues. By doing so, we can empower older adults to lead fulfilling and autonomous lives. And the societies around the world are coming to terms with the fact that their aging population is increasing, and they are hopefully starting to prioritize the independence of older people. It's not a moral imperative. It is a moral imperative. That's what I meant to say. It is a moral imperative, but it's also a path to stronger, more inclusive communities for all of us, of all ages. So when we invest in solutions today, we ensure that future generations have a brighter, longer, more quality of life outcome. And that I say, I will be posting links, of course. And if you enjoyed this video, please, I encourage you to subscribe and share and explore what is said. Share with those who might enjoy this, who might benefit from this. And that would include younger family members who may be in a partial caregiving or a supportive position. And remember, to be senior is to be proud. Hugs.